Yeah, look, you want to make sure that someone's doing it, and probably the word here is thorough, as opposed to a screening for, because even in an eye exam you could do a fairly light basic test of binocular skills, but we certainly want that to be considered thorough and comprehensive. We want a thorough and comprehensive test of accommodation and focusing, and we want a thorough and comprehensive test of ocular motor skills, and we also want to know, will you screen for visual processing issues if indicated? And so they're probably the key ones. What we like to do in our practice is also provide a report to all the kids that we see, so that, or to the parents obviously, so that they've got something there that gives them, a snapshot in time of what the child's current visual skills are, outline any plans that or advice that might be part of it, and then they can pass it on to teachers. So, the key parts are, yes, a thorough test of eye teaming, focusing, eye movements, and do you provide a report, and will you do visual processing screening when indicated is the short answer.
So when parents go to a clinic that has an interest in children's vision, they shouldn't leave wondering what happens next. They should understand what was found, what it means, and what the plan going forward is. Is that right?
Absolutely. And that's the key part. And when we're training other optometrists, we do a little bit of training in our practice that we talk about that whole, if there's no symptoms at the moment, you're still wanting to do a comprehensive assessment, because that way you get to have those conversations, a bit like my example earlier of, that grade 1 student who is showing some signs of some visual dysfunction, but is not at a symptomatic level at this stage. But you want to set the scene and just have parents be aware of that as a potential problem in the future. And that's an important part of a vision exam as well.
And so even for a child that isn't showing early signs of myopia, would you still have that discussion with parents about how to put in place sort of like proactive strategies to prevent that developing?
Yeah, and I guess that probably pops up in kids where they've still got good sight, but there might be a little trajectory of heading towards myopia. You certainly would definitely bring that up if we can observe that or we know from the case history that there's a family history of myopia, or if the kid spends a vast amount of their time engaged in devices and indoors, and they're not participating in sporting activities. And so you want to have that discussion.